And now experts across the health spectrum, including the World Health Organization and the National Action on Sugar Reduction Coalition for advocating for an increase in tax on sugar-sweetened beverages and policies to tackle the rising prevalence of non-communicable diseases in Nigeria. They say their demand to increase SSB's tax from 10 naira to 20 naira is based on the need to create an impact on purchasing behavior and consumption of sugar-sweetened beverages to discourage consumption. The rationale behind the tax is to combat the escalating consumption of SSBs, which have been linked to an alarming array of health concerns, including over 15 types of cancer, obesity, diabetes, and various non-communicable diseases.
We have consulted across the region for those of you following us, and feedbacks has been very, very consistent, which are that the current 10 naira per litre is insignificant. For the desired reduction of consumption, decrease in NCDs, that tax must be increased to minimum of the 20% of the retail price. So we're saying government should not succumb to any blackmail. And today we are saying that the social contract of government with the people is also the promotion of public health. Government exists to put in place policies that will ensure that we lead healthy lifestyles, and the SSB tax is part of that social contract. They should stand firm, not only protect, sustain, but increase that tax. Several other SSBs were not actually captured in this first regime of the tax. Government should begin to ensure that every other SSB that were not captured were also included in the tax bracket. And lastly, that we will continue to ask questions, and that government should account for the taxes they have been collecting. So,
other health experts also underscored the importance of collaboration and awareness in tackling the challenges posed by sugar-sweetened beverages. They stated that legal backing would ensure full implementation of the policy.
We know that consumption of sugar-sweetened beverages habitually leads to non-communicable diseases. Now, data has also confirmed. Now, we get this data from 3 sources. First is from the company data that showed a significant rise in the production and consumption of sugar-sweetened beverages in Nigeria, again in the last decade. Now, NCDs have been rising. We know that NCDs can be caused by sugar-sweetened beverages, and then in Nigeria, we've seen the increase in the consumption of sugar-sweetened beverages. So it's definitely obvious that this consumption, habitual consumption in the country, is directly associated with the health challenges we're having. But we need a solution. Now, one of the solutions is simple. We need to drive down the consumption of sugar-sweetened beverages. There needs to be a great proactive method. One of the ones that we know that has been very effective is the imposition of the sugar-sweetened beverages tax.
Advocates in this room are calling on the Nigerian government to think towards sustainability of the SSB tax through legislation. So this is an important tax that promotes health, promotes healthy living, and it should be sustained, it should be supported, it should be promoted at all levels. Taxes on SSBs should be high enough to cause a significant increase in the final price of these harmful products.
For an effective SSB tax, there must be an effective implementation. Nigeria has policies. Nigeria is very good at making policies. We must applaud this nation because this nation is among the very few African countries that has taken this initiative. But taking the initiative is not enough. There needs to be an implementation. And for there to be an implementation, it has to be backed up by law. It has to be backed up by legislative framework. Finance Act is something that is transitory. It is something that is temporary. It is something that is subject to review. It is something that is subject to political debates.